Hello everyone. I am myself Dr. 𝗛𝐽𝐽𝐸𝐽𝐸𝐸𝐽𝐸𝐸𝐽𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸𝐸 taking the multiple choice questions on the topic of the pneumonia. So after having a detailed discussion of the theory related to pneumonia, now let me take up the discussion of the multiple choice questions related to pneumonia. So the first question is, all are true about the �𝐾𝐝65 score except respiratory rate more than 30 per minute, blood urea nitrogen more than 7 millimoles per liter, systolic blood pressure more than 100 millimeters of mercury, confused state. Okay. So first of all, what is this 𝐾𝐝65? It is a scoring system which will assess the severity of the pneumonia. And out of this, the word C, it stands for confusion, for which you need to give a score of 1 point. And the word U stands for urea, that is blood urea nitrogen levels more than 7 millimoles per liter. If it is there, give a score of 1 point. Then R stands for respiratory rate more than 30 per minute, give a score of 1 point. Then B stands for systolic blood pressure. And how much should be that systolic blood pressure? Systolic blood pressure, it should not be more than 100 millimeters of mercury. Systolic blood pressure, it should be less than 90 millimeters of mercury in the 𝐾𝐝65. And what does this 65 stands for? 65 stands for the age of the individual, right? That is, the age of the individual should be more than 65 years, then we need to give 1 point. And systolic blood pressure, it should, if it is less than 90 millimeters of mercury, then we give a score of 1 point. Okay, so the answer is C, right? The answer is C. So systolic blood pressure, it should not be more than 100 millimeters of mercury. Systolic blood pressure, it should be less than 90 millimeters of mercury. All right, next question. Which of the following association is correctly paired? The options are aspiration pneumonia Streptococcus pyogenes, second option, heavy alcohol use atypical pathogens, poor dental hygiene Chlamydia and Klebsiella pneumonia, structural lung disease Burkholderia. So which of the following is like correctly paired? So first and foremost, you take the aspiration pneumonia. See, aspiration pneumonia is the one which occurs in an individual who is like completely depressed. Okay, so in depressed individual, or in an individual depressed consciousness, depressed in the individual in the sense the individual should be having a depressed consciousness, right? Or the individual should be in a state of altered sensorium. In them, the aspiration pneumonia is very common. Now, among this, the organisms causing aspiration pneumonia, the organisms which are very common is, number one, the oral anaerobes, right? Number one, the oral anaerobes and the gram-negative bacteria. Right, oral anaerobes and as well as the gram-negative bacteria. So these are the organisms which will be causing the aspiration pneumonia. Now you take the heavy alcohol use. Heavy alcohol use also leads to depressed level of consciousness. Once there is depressed level of consciousness, again the individual will land up in what is called as the aspiration pneumonia. All right. So once there is aspiration, what are the organisms? It is the oral anaerobes and as well as the gram-negative bacteria. All right. Next, coming to the poor dental hygiene. Poor dental hygiene, what is the organism which will be causing pneumonia when there is a poor dental hygiene is, poor dental hygiene, it leads to Streptococcus mutans, right? It will be Streptococcus mutans. All right. The only one which is correctly paired or matched is the structural lung disease. So whenever there is structural lung disease, there are two important organisms which will be causing pneumonia. So one is Burkholderia and the other one is Pseudomonas. Right, Burkholderia and as well as the Pseudomonas. Okay, so these are the organisms that will be causing pneumonia whenever there is a structural lung disease. All right, and also a very important point that you need to note down is you need to know the risk factor and the respective pathogens. So in this though, like we have only 4 options, right? But let me tell you the other risk factors and the respective pathogen. Now you take the individuals, right? So you take the individuals with alcoholism. What will be the organisms, possible pathogens causing pneumonia is Streptococcus, oral anaerobes, Klebsiella pneumonia, Acinetobacter, and Mycobacterium tuberculosis. These are the possible pathogens that will be causing the infection of the lung parenchyma in case of the alcoholics. Then coming to individuals with COPD and as well as smoking, right? COPD and smoking. In cases of the COPD and as well as smoking, the organisms that will be causing pneumonia will be the Haemophilus influenza, then Pseudomonas aeruginosa, Legionella species, Streptococcus pneumonia, Moraxella catarrhalis, Chlamydia pneumonia. So these are the organisms that will be causing pneumonia in individuals who are having COPD or individuals who are a smoker. And structural lung disease, just now we were discussing Pseudomonas and as well as Burkholderia, and apart from that even Staphylococcus aureus. And in individuals who are having the risk factors like dementia, stroke, decreased level of consciousness, in them the organisms are the oral anaerobes, gram-negative enteric bacteria, right? Gram-negative enteric bacteria. Then followed by that, if an individual is having the risk factor of the lung abscess, then in those group of individuals, the possible pathogens are the community acquired methicillin resistant Staphylococcus aureus, oral anaerobes, then Mycobacterium tuberculosis, and then atypical mycobacteria. So atypical mycobacteria, this is one of the very important pathogen in individuals who are having the lung abscess. So this entire table is very, very important. So this is the risk factor and then the possible pathogen, because in the clinical scenarios where you are not able to do a culture and sensitivity, right, or in a clinical setup where the culture and sensitivity is not there, in such case, depending upon the risk factor, you need to think of the pathogen and accordingly you need to hit the antibiotic. Okay, so in that case this particular table becomes very, very important thing. Okay, next question is, Klebsiella pneumonia has the following characteristic features except. The options are: the upper lobes are frequently involved, Pneumatocele may occur commonly, empyema is much more common, lung abscess formation is very uncommon. Now you take this Klebsiella pneumonia, the pneumonia which is caused by Klebsiella pneumonia, the another name for this is also called as the Friedlander's pneumonia, right? This is also called as the Friedlander's pneumonia. Now in case of the Klebsiella pneumonia, the lobes which are affected is the upper lobes, and that too, which part of the upper lobe? That is the posterior segment of, right, that is the posterior segment of the right upper lobe. They are the one which are very commonly affected, and that posterior segment of the right upper lobe which is being affected, and this is what is called as, right, so this is what is called as bulging fissure sign. Right, so this is what is called as the bulging fissure sign. And what about Pneumatocele? Pneumatocele can also be seen in patients with the Klebsiella pneumonia. Pneumatocele is observed in patients with Streptococcus pneumonia, Staphylococcus aureus, and even the Klebsiella. All right, and this Klebsiella, it is very common in alcoholics. Right, it is very common in alcoholics, and as well as it is also very common in immunocompromised patients. Right, it is also very common in immunocompromised patients. And which lobe is affected? That is the upper lobe involvement is very, very common, right? Then coming to the chest x-ray. The chest x-ray, it shows homogeneous non-segmental lobar consolidation. So what type of pneumonia is caused by your Klebsiella? The type of pneumonia which is caused by Klebsiella is the lobar pneumonia. Right, the type of pneumonia will be the lobar pneumonia, right? And what is which particular lobe? That is posterior segment of the right upper lobe, and that is what is called as the bulging fissure sign. All right, and in this individual also, I said you, like, you have the presence of the Pneumatocele. What is this Pneumatocele? It is the scenario where there is a air filled pocket, right? It is a thin walled air-filled pocket. That is what is called as the pneumatocele. And in these patients, the empyema is also very common because it's a very aggressive organism. It will cause the pleural effusion and also accumulation of pus in the pleural space, and that is what is called as the empyema. All right. And now what about the lung abscess? Lung abscess is also very common. Right, lung abscess is also very common. Okay, lung abscess is very common, cavity formation is very common, empyema is also very common in cases of the Klebsiella. All right. And not only this pleural effusion and as well as empyema, there can be even pulmonary necrosis as the disease progresses. Right, so there can be even pulmonary necrosis. So this pulmonary necrosis can progress to what is called as the necrotizing pneumonia. So the one which is incorrect statement about Klebsiella is lung abscess formation is very uncommon is an incorrect statement. All right, next question. A 28-year-old woman presented with high-grade fever, cough, diarrhea and mental confusion for 4 days. X-ray revealed bilateral pneumonitis. Search for the etiology will most likely reveal Streptococcus pneumonia, Staphylococcus aureus, Legionella pneumophila, Pseudomonas aeruginosa. Okay. So now in this individual, you are having a high-grade fever, cough, diarrhea. Diarrhea is very, very important. Diarrhea and as well as the mental confusion, and X-ray is showing bilateral pneumonitis. So this is the organism where the individual is having the pneumonia and as well as there is the extrapulmonary manifestations. Right, as well as there is extrapulmonary manifestations. And what is that extrapulmonary manifestations that you have here is the development of diarrhea. The development of the diarrhea. Okay. And along with diarrhea, like you have the mental confusion. And what could be the reason for the mental confusion? Please remember, in respect to the diarrhea, these patients will develop the hyponatremia. Right, these patients will develop the hyponatremia. So whenever there is hyponatremia, the individual will be in a state of altered sensorium. The individual will be in a state of altered sensorium. And the X-ray just is revealing bilateral pneumonitis. Now, what is that organism which will be causing diarrhea is the Legionella pneumophila. Okay, so it is the organism which will be causing the atypical pneumonia. Right, it is the organism which will be causing the atypical pneumonia. So atypical pneumonia in the sense the typical features of consolidation are absent. Right, the signs of consolidation are absent. That is what is called as the atypical pneumonia. And in these individuals, the cough is also a dry cough. It is not the cough with expectoration. It's completely a dry cough. Okay, and you take the antibiotic. The drug of choice for the treatment of Legionella, it is azithromycin. Right, it is azithromycin. Now there are certain clues suggestive of Legionella pneumonia. First clue is diarrhea. Second important clue is high grade fever. Right, and when you do a complete blood picture, what is that you will have in the complete blood picture is you will have the neutrophilia. So there will be numerous neutrophils. Right, there will be numerous neutrophils, but no organism is revealed by gram staining. Numerous neutrophils, but no organism revealed by gram staining of the respiratory secretions. And the other point feature suggestive of your Legionella is hyponatremia. But in question, hyponatremia is not given, but the clinical feature related to hyponatremia, that is confusion, is given in this particular question. And the treatment of choice, what did we discuss? That is azithromycin. So the clue, right, the clue is there is failure to respond to beta-lactam group of antibiotics. Right, Legionella, they don't respond to your, right, it does not respond to your beta-lactam group of antibiotics. Okay. And next important question. So this is about the Legionella now. Next. Drug of choice for Mycoplasma pneumonia is, the options are penicillin, tetracycline, cefuroxamine, then erythromycin. So Mycoplasma pneumonia, it is the one which will be causing the atypical pneumonia, right? And this Mycoplasma pneumonia, it is the smallest living organism causing atypical pneumonia that is best treated by erythromycin, right? Or the other macrolide group of antibiotics that can be given apart from erythromycin is, you can give azithromycin, right? You can give azithromycin, or the other alternative will be clarithromycin can also be given, right? Clarithromycin can also be given. So the drug of choice for Mycoplasma pneumonia will be erythromycin among the options which has been given to you, or azithromycin or clarithromycin. Next question. Pneumonia with confusion and diarrhea. Just now we have discussed this question, right? Legionella, Mycoplasma, Chlamydia, and Pneumocystis carinii pneumonia. Okay. Now, one point I want to tell you is, okay, this is a straight question, that is Legionella. But the point that you need to understand here is, all these organisms, they cause the atypical pneumonia, right? All these organisms, they cause atypical pneumonia, or we call it as the interstitial pneumonia. Right, we call it as the interstitial pneumonia. All right, and Mycoplasma, as just now I was discussing, it's the smallest living organism. And what about chlamydia? Even the chlamydia pneumonia, or we have what is called Chlamydia psittaci. Right, the Chlamydia psittaci is that which will cause psittacosis. Right, it is the one which will cause psittacosis. All right, and the causative agent, as I have said you, Chlamydia psittaci, it is the one which will be causing the interstitial pneumonia. And here also the drug of choice is azithromycin. Right, the drug of choice is azithromycin. And for how long you need to give this azithromycin is, the antibiotic you need to give for nearly around 7 to 10 days. Okay, so that is about the Chlamydia psittaci. So the answer here, the pneumonia with confusion and diarrhea, that is Legionella. All right, next question. In HIV positive patients with Pneumocystis jirovecii infection, which of the following is used for prevention? Azithromycin, acyclovir, levofloxacin, trimethoprim, sulfamethoxazole. All right. So please remember, this Pneumocystis jirovecii infection, it is very common in immunocompromised patients, and it is the one which will be causing interstitial pneumonia. Right, it is the one which will be causing the interstitial pneumonia. All right, and the drug of choice for PCP pneumonia is trimethoprim sulfamethoxazole. Right, trimethoprim sulfamethoxazole. And whenever you give this TMP SMX, trimethoprim sulfamethoxazole, it prevents many opportunistic infections. Right, it prevents many opportunities. So the advantage is, right, it prevents many opportunistic infections, right? And what are those opportunistic infections? Like Toxoplasma gondii, gastrointestinal infection, and urinary tract infections, right? So these are all the advantages of giving trimethoprim sulfamethoxazole, right? And whenever you are giving this trimethoprim sulfamethoxazole, you need to just be closely monitoring about the adverse effects such as Stevens-Johnson syndrome. All right, but the drug of choice for PCP pneumonia will be trimethoprim sulfamethoxazole. But as such, for the treatment of PCP pneumonia, we have many other alternative drugs also. We have like pentamidine, then we also give dapsone, right? We also give quinine. So these are all the alternative drugs, but the drug of choice will be trimethoprim sulfamethoxazole. All right, next question. Right. So 𝐾𝐝65 includes all except, just now we were discussing, this was our first question in the discussion, but here let me tell you in what way the 𝐾𝐝65 will be useful is what I'll be discussing in this question. Age more than or equal to 65 years, respiratory rate less than 30 per minute, systolic blood pressure is less than 90 millimeters of mercury, blood urea nitrogen is more than 7 millimoles per liter. Okay, so 𝐾𝐝65 includes all except among the options which has been given to you the respiratory rate. So respiratory rate, it should not be less than 30 per minute. Respiratory rate, it should be more than 30 per minute. And what are the parameters in 𝐾𝐝65? Already I have discussed in the first question. And the importance of the 𝐾𝐝65 is the 𝐾𝐝65, it is useful in predicting the mortality. Right, 𝐾𝐝65, it is useful in predicting the mortality in community acquired pneumonia patients. Right, predicting the mortality in community acquired pneumonia patients. Now, so like what is the score you get? The maximum score in 𝐾𝐝65, that is 5. Confusion if it is there, 1. Urea levels more than 7 millimoles per liter, then 1. Then respiratory rate more than 30 per minute, 1. Blood pressure, systolic blood pressure less than 90 millimeters of mercury, then give a score of 1. And age more than 65 years, give a score of 1. All right. Now, the point is, right, now the point is, if at all, if the score is 0 to 1, then what is the chance of the mortality rate? The chance of the mortality rate is around 1.5% if the score is 0 to 1, right? And this can be treated on the OPD basis. Okay, this can be treated on OPD basis. And these patients, they don't require the ICU admission. If suppose, if the score is like 2, then this particular patient's, the 30-day mortality, if you observe, right, 30-day mortality is around 9.2%. 30-day mortality rate is around 9.2%. And here, the patient has to be admitted in the hospital. Right, patient has to be admitted in the hospital. All right. Then you take score 3. And when the score is 3, the mortality rate, the 30-day mortality rate is nearly around 22%. Right, 30-day mortality rate is overall 22%. And these patients, they require ICU admissions and as well as the IV antibiotics. Okay, so this is the importance of the 𝐾𝐝65. All right, next question. Which is correct about the pneumonia? Bronchophony, decreased vocal phlebitis, shifting of the trachea, amphoric breathing. So the points that you need to know regarding the pneumonia is that bronchophony, yes, it will be there. I'll tell you what is that. And vocal phlebitis is increased in patients with pneumonia. It is not decreased. And trachea, it is not shifted to either side. And amphoric breathing will be absent. You will have tubular type of bronchial breath sounds. You will have bronchial breath sounds, but it is the tubular type of the bronchial breath sounds. All right. And very important point is how many types of bronchial breath sounds do we have? Tubular, amphoric, then cavernous. These are the 3 types, right? Tubular, amphoric, and cavernous. So out of these 3, the one what you have in consolidation, that is pneumonia, that will be tubular type of bronchial breath sounds. And where do you have other types? I'll be discussing that subsequently. And you take bronchophony. What is bronchophony? Bronchophony is the phenomenon of patient's voice remaining loud at the periphery of the lung. Okay, so the patient's voice right, the patient's voice remaining loud at the periphery of the lung. Okay, so that is what is called as the bronchophony, right? And in case of bronchophony, the sounding, it is louder than usual. right? It will be louder than usual. That is called as bronchophony. And the additional sounds that you have in patients with pneumonia apart from bronchophony is that they also have the egophony, right? They also have the egophony. What is egophony? Egophony is the auscultation of the sound ah, right? Actually, the patient tells the word E. You place the stethoscope over the consolidated area and you ask the patient to tell the word E. The word E is heard as ah. Okay, so auscultation of the sound ah instead of E, right? Instead of E. This is what is called as the egophony, right? Then the another important additional sound will be whispering pectoralicae. Right? The other one will be whispering pectoralicae. All right. Now, this whispering pectoralicae is what you place the stethoscope over the consolidated area, right? And you ask the patient to whisper. You ask the patient to whisper. And once the patient whispers, it appears that the patient is directly whispering into your ear. That is what is called as the whispering pectoralicae. So these are all the additional auscultatory sounds that you have in patients with the pneumonia. And vocal phlebitis is increased, vocal resonance is also increased in these patients. And trachea, it is central in position, it is not shifted. And amphoric breathing will not be there. Tubular type of bronchial breath sounds is what is being present. Alright, next question. Unipolar flagellate organism that causes pneumonia. Pseudomonas, Mycoplasma, Aeromonas, then the Klebsiella pneumonia. So, which is the unipolar flagellate organism that is causing pneumonia is, that is Pseudomonas, right? It is Pseudomonas aeruginosa. Pseudomonas aeruginosa. And this Pseudomonas aeruginosa, it is not only a unipolar flagellate organism, it is also a gram-negative organism, right? And it is an aerobic organism. And it is rod-shaped organism, right? And having a unipolar motility. Right, having unipolar motility. All right, and you take Klebsiella. Klebsiella is also gram-negative, but it is non-flagellate. But it is non-flagellate. You don't have flagella for the Klebsiella. What is given is unipolar flagellate. All right, and the other point is the Pseudomonas. It's an important opportunistic pathogen which is responsible for ventilator-associated pneumonia. Which is responsible for ventilator-associated pneumonia. All right, and this ventilator-associated pneumonia due to Pseudomonas aeruginosa is usually a multi-drug resistance, right? It is multi-drug resistance, right? And this is associated with severe infection. Right, this is associated with severe infection and there is increased mortality. Right, severe infection and increased mortality. So that is about the unipolar flagellate organism that is causing pneumonia, that is the Pseudomonas. All right, next question. Pneumatocele is caused by Streptococcus pneumonia, Haemophilus influenza, Serratia marcescens, and then the Klebsiella pneumonia. Right, pneumatocele, it is caused by the Streptococcus pneumonia. In fact, if you see Streptococcus pneumonia, Haemophilus influenza and Klebsiella, these three organisms will be causing pneumonia. But among all these, the more common is the Streptococcus pneumonia, right? And not only that, even the Staphylococcus aureus, even this is also responsible for the development of the pneumatocele. What is this pneumatocele? Pneumatocele is a thin-walled, air-filled cyst, right? It's a thin-walled, air-filled cyst that developed within the lung parenchyma. Thin-walled air-filled cyst within the lung parenchyma. That is what is called as the pneumatocele, right? And this particular pneumatocele, it is like a single emphysematous lesion, right? Single emphysematous lesion. And once this particular pneumatocele ruptures, then there can be chance of development of pneumothorax, all right? So that is about the organisms which are causing pneumatocele. Next, round pneumonia is seen in Streptococcus pneumonia, kerosene oil aspiration, lung cancer, Mendelssohn syndrome. Okay, so round pneumonia, the organism is the Streptococcus pneumonia, right? Now, what is this round pneumonia? Let me explain to you. Round pneumonia, it is the one which will, it is like, as the name itself tells you, like it will be as a round opacity, but it will be like non-homogeneous opacity, right? It will be like non-homogeneous opacity, right? And it mimics the pulmonary mass, right? This round pneumonia, it mimics the pulmonary mass, all right? And this particular round pneumonia, which is caused by Streptococcus pneumonia, you observe this mainly in children, not in adults. Whereas you take Streptococcus pneumonia in adults, what it will cause? It will cause lobar pneumonia, or it will cause lobar consolidation. Right, it will cause lobar pneumonia or lobar consolidation. Right, now let me explain to you why that round pneumonia is observed only in children. Why not in adults? Let me tell you why in adults it is lobar, why in children it is round. Let me tell you. So you have what is called as the pores of Kohn. These are the communications between the alveoli, and we have the channels of Lambert. They are the one which will communicate the bronchi and as well as the alveoli. These are the bronchoalveolar communication, right? If suppose, if there is the infection which is caused by the pneumonia, right? If there is infection caused by the Streptococcus pneumonia, now this Streptococcus pneumonia can spread from one alveoli to the other alveoli in adults, because these pores of Kohn and as well as the channels of Lambert, they are developed only in adults, right? They are developed only in adults. They are not yet seen in children. So in adults, what will happen is the infection from one alveoli, it is spread to the other alveoli in that entire lobe, resulting in the lobar pneumonia or lobar consolidation, right? Resulting in lobar pneumonia or lobar consolidation. So the infection is spread through this interalveolar communication, and the infection is spread through this collateral airways. Okay, so it is spread through the interalveolar communication and as well as the collateral airways through these pores of Kohn and as well as the channels of Lambert. All right, so you see this only in adults, that will allow the lateral dissemination of infection throughout the lobe, resulting in lobar pneumonia. Whereas in children, these are not yet developed. That is the reason why, because they have not yet developed, there is limited spread of infection. Right, there is limited spread of infection, and that will result in the round pneumonia. That will result in round pneumonia. So this is about the round pneumonia story, which is seen only in children, and the organism is Streptococcus pneumonia. Right, next question. Which of the following is not correct about the aspiration pneumonia? 5 to 15% of the community acquired pneumonia, it is due to the aspiration pneumonia. Second option, the anaerobic infection is most common. Superior segment of the apex of the lung is commonly involved in the recommend position. 20 to 25% of the fluid less than pH 2.5 is required for aspiration pneumonia. Is required for aspiration pneumonia. So the question is basically completely about the aspiration pneumonia, right? So what you have to understand is, depending upon the position of the patient, right, while aspiration, the lobe of the lung which is involved is completely different. Like for suppose, when the individual is in supine position, has undergone aspiration, the lobe which is affected is superior segment of the right lower lobe. When the individual is like standing or sitting, and then there is aspiration, then there is involvement of posterior basal segment of the right lower lobe. The individual is lying down in right lateral side, right, lying down on the right side, then if there is aspiration, then there will be involvement of the right middle lobe or the posterior segment of the right upper lobe. And when the individual is in recumbent position, then the aspiration has occurred, then the posterior segment of the upper lobes are affected. Okay, let me show you that table, very very important table. This table is very important. So the individual is in supine position and aspirated. The lobe which is affected is superior segment of right lower lobe. The individual is in sitting or standing position. The posterior basal segment of the right lower lobe is involved upon aspiration. The individual is lying on right side, then there is aspiration, so right middle lobe or posterior segment of the right upper lobe is affected. When aspiration occurs, the patient is in recumbent position, then the posterior segment of the upper lobe and superior segment of the lower lobes are commonly involved in the lung. So depending upon the site, now you see the options. Now when the individual is in recumbent position, what is given to us? The superior segment of the apex of the lung is commonly involved. That is a wrong statement. In recumbent position, what did I tell you? It is the posterior segment of the upper lobe. Right, it is the posterior segment of the upper lobe that is very commonly affected in the recumbent position, right? Posterior segment of the upper lobe and the superior segment of the lower lobes. So your C is the answer, because the question asked is not correct. And what about the other options? 5 to 15% of community acquired pneumonia is due to aspiration pneumonia. Yes, it's a true statement. Okay. And for the aspiration to occur, right, for the aspiration to occur, you require minimum 20 to 25 ml of the fluid where the pH should be less than 2.5. That will result in the aspiration pneumonia. Whereas small amounts of material from the buccal cavity during the sleep, if it is aspirated, that will not cause aspiration pneumonia, right? That will not cause aspiration pneumonia, right? And in healthy persons, the aspiration pneumonia does not occur. Why? Because in healthy persons, the aspirated material is cleared by the mucociliary action. All right, the aspirated material is cleared by the mucociliary action, and it is cleared by the alveolar macrophages. Right, it is cleared by the alveolar macrophages. So that is the reason why in healthy persons, the aspirated material will not cause the aspiration pneumonia, right? And you take this Mendelssohn syndrome, that is the acidity of the gastric contents will result in the chemical burn to the tracheobronchial tree. That is called chemical tracheitis or chemical aspiration, which is called Mendelssohn syndrome. All right, and the pH of the aspirated material should be less than 2.5, and the volume of the aspirate, it should be around 0.3 ml per kg body weight. See, it need not be a standard 20 to 25 ml. It all depends upon the weight of the individual. So minimum how much it should be aspirated? 0.3 ml per kg body weight should be aspirated. That can cause the chemical that can cause the chemical pneumonia, right? And the most common organisms will be the anaerobic infections itself, right? And in case of the chemical burn, initially there will be a chemical burn which is caused by the acid where the pH is less than 2.5, and that chemical burn is followed by the inflammatory cellular reaction. Okay, that chemical burn secondary to the acid, this will be followed by inflammatory cellular reaction, right? And this inflammatory cellular reaction, it is due to the release of the potent cytokines. Right? It is due to the release of the potent cytokines. What are these potent cytokines? That includes the tumor necrosis factor and as well as the interleukin 8. These are the potent cytokines that will be causing the inflammatory cellular reaction. All right. So the answer here is 5 to 15% of community acquired pneumonia, that is due to aspiration pneumonia, is correct. Anaerobic infection is most common, that is also correct. And superior segment of the apex of the lung is commonly involved is a wrong statement. It is a posterior segment of the upper lobe which is commonly affected. And even the fourth point is also correct statement. All right. Next question. Breath sounds are decreased in the following except lobar pneumonia, pneumothorax, pleural effusion, and atelectasis. The answer is lobar pneumonia. In lobar pneumonia, the breath sounds are not decreased. So in fact, in lobar pneumonia, the type of breath sounds that you will have is the tubular type of the bronchial breath sounds. Right, the tubular type of the bronchial breath sounds. So this tubular type of the bronchial breath sounds, they are in fact, they are high-pitched sounds. In fact, they are high-pitched sounds. Whereas in pneumothorax, pleural effusion, and atelectasis, the breath sounds, they are reduced. Okay, so pneumothorax, pleural effusion, and atelectasis, the breath sounds are reduced. Okay, now let me talk about the breath sounds as such. So if you take the breath sounds, they are of two types. One is vesicular breath sounds, right, and the other one is the bronchial breath sounds. Okay, vesicular breath sounds and bronchial breath sounds. So you take the vesicular breath sounds. Vesicular breath sounds, they are the one which are present in a normal person. Right, they are the one which are present in a normal person, and they are heard over the lung parenchyma. Right, they are heard over the lung parenchyma, and they are low intensity sounds. And the intensity is the one which is a very important differentiating factor between vesicular breath sounds and bronchial breath sounds. Okay, and the next important point related to the vesicular breath sounds is the inspiration is more than compared to that of the expiration. Okay, so this is inspiration and this is expiration. All right, this is the characteristic feature of vesicular breath sounds. Whereas bronchial breath sounds, can you listen that in a normal person? Yes. In a normal person, you can listen the bronchial breath sounds over the trachea. Otherwise, the bronchial breath sounds, they are pathological sounds. If you are listening the bronchial breath sounds over the lung parenchyma, then they are considered to be pathological. Right? They are considered to be pathological. Okay. And what will be the character of these bronchial breath sounds are, they are high intensity sounds when you compare them with, right, when you compare that with the vesicular breath sounds. And if you take the bronchial breath sounds, the expiration is prolonged. Right, so this is inspiration and this is expiration. So expiration is prolonged, and between inspiration and as well as the expiration, you have a gap. Right, between inspiration and expiration, you have a gap. Okay, so these are the characteristic features of the bronchial breath sounds. Now you take these bronchial breath sounds. The bronchial breath sounds, they are totally of three types. Right, bronchial breath sounds, they are totally of three types. Now what are these three types of the bronchial breath sounds is, the three types of bronchial breath sounds, they include, number one, tubular type of bronchial breath sounds, then cavernous type of bronchial breath sounds, and then amphoric type of bronchial breath sounds. Okay, so tubular type of bronchial breath sounds, they are the one which are high pitched sounds, right? Whereas cavernous type of bronchial breath sounds, they are low pitched sounds. Amphoric breath sounds are the one which are with metallic quality. Okay, so which are the one with metallic quality, that is your amphoric breath sounds. All right, and you take this tubular type of bronchial breath sounds, you listen that in patients with pneumonia with consolidation. All right, whereas in cavernous type of breath sounds, they are heard over the cavity, right? They are heard over the cavity which is present over the superficial part of the lung. And amphoric type of breath sounds are the one which are heard in the tension pneumothorax, right? Which are heard in case of the tension pneumothorax. All right, and they are also heard in the cavity which is present deep in the lung. That is about amphoric breath sounds. So this is about the abnormal breath sounds, which are nothing but bronchial breath sounds. Whereas the normal type of breath sounds that you will have is the vesicular type of the breath sounds. Okay, so the answer here is lobar pneumonia. Okay, so lobar pneumonia, breath sounds are not decreased, lobar pneumonia is increased. Right, next question. Pneumonia severity index in adults, the most important factor is age, congestive heart failure, hyponatremia, hypothermia. So pneumonia severity index in adults, the most important factor is the age. What exactly is the pneumonia severity index? This is also one of the parameter which will tell you the severity of the pneumonia. And there are many factors which are taken into consideration in pneumonia severity index. Let me show you all these. So these are all the factors which have been taken into consideration in case of the pneumonia severity index. Age, men, women, that is gender, right? Any coexisting illness, neoplastic diseases, liver pathology, congestive heart failure, renal pathology, right? Any altered mental status, right? Then the respiratory rate more than 30, systolic blood pressure less than 90, temperature more than 40, pulse rate more than 125, pH less than 7.35, sodium less than 130, glucose more than 250, hematocrit less than 30. See, like this, many parameters are there. Out of all these, the very important parameter which is taken into consideration in pneumonia severity index is the age of the individual, right? And what is another important index which will tell you about the pneumonia severity? That is your 𝐾𝐽65. All right, next question. X-ray findings of the Staphylococcus are all except Pneumatocele, hilar lymphadenopathy, empyema, visible air bronchograms. Okay, so Staphylococcus aureus, it is the one which will cause the bronchopneumonia, and to certain extent it will also cause the lobar pneumonia, right? And in case of the Staphylococcus aureus, you have that cavitation and abscess formation. So you have, in all these cases wherever there is lobar consolidation or consolidation of the lung parenchyma, you will notice that there is visible air bronchograms, right? And there is also accumulation of pus within the pleural space, which is called as the empyema. Okay, and pneumatocele is also observed in patients with Staphylococcus aureus. But what is that not observed in Staph aureus is the hilar lymphadenopathy, right? Hilar lymphadenopathy is not observed. Okay, next question. tubular breathing is seen in, just now we were discussing pleural effusion, then consolidation, pleurisy, tuberculous cavity. So like where is that you will have tubular type of bronchial breath sounds, that is consolidation. And whereas you take in pleural effusion, the breath sounds are reduced. Even in patients with pleurisy, the additional sound that you will have in pleurisy will be the pleural rub. Right, the pleural rub. And what about in the tuberculous cavity? So if you take in the tuberculous cavity, over the cavity, the type of breath sounds that you will listen is the cavernous type of the breath sounds. Right, cavernous type of breath sounds. All right. So this is about the tubular bronchial breathing. Next question. A 28-year-old female has diarrhea, confusion. Right, 28-year-old female has diarrhea, confusion, high-grade fever with bilateral pneumonitis. What do you think is the diagnosis? The options are Legionella, Neisseria meningitis, Streptococcus pneumonia, Haemophilus influenza. Right? So it's a repeat question actually. Diarrhea, confusion, high-grade fever, pneumonitis. Suggestive of Legionella. And what is the drug of choice in case of Legionella? That is azithromycin. Right? Azithromycin. And who are at risk of developing this Legionella pneumonia is diabetic patients. Next, patients with leukemia, elderly individuals, children, they are at increased risk of development of Legionella pneumonia. Alright, next question. All of the following features are seen in viral pneumonia except the options are presence of the interstitial inflammation, predominance of the alveolar exudate, bronchiolitis, multinucleate giant cells in the bronchial wall. Right? So all of the following features are seen in viral pneumonia. See, viral pneumonias, what do they cause is, they cause the interstitial pneumonia. Right? They cause the interstitial pneumonia. Alright? And they cause or they will have interstitial inflammation, definitely. There's no doubt in that. Right? And the exudate is confined only to the interstitium. The exudate is confined only to the interstitium. You don't have the alveolar exudate. The question asked is except. Predominance of the alveolar exudate is an incorrect statement. Okay. Then what about bronchiolitis? Bronchiolitis is observed in patients with the viral pneumonia. And multinucleate giant cells in the bronchular wall is also observed in cases of the viral pneumonia. So predominance of the alveolar exudate is an incorrect statement related to the viral pneumonia. Now, what are all the various viruses which will be causing interstitial pneumonia is cytomegalovirus, adenovirus, then COVID-19, Epstein-Barr virus. All these can cause the interstitial pneumonias. Alright, next question. All of the following statements about the Pneumocystis jirovecii are true except usually associated with CMV infection, may be associated with Pneumatocele, usually diagnosed by sputum examination, right? It causes disease only in the immunocompromised host. The options are these. Now, which is the incorrect statement? The question asked is except. Please remember, Pneumocystis jirovecii, it is not associated with the CMV infection, right? It is not associated with this. Usually associated with CMV infection is an incorrect statement, right? And in case of PCP pneumonia, do you have Pneumatocele? Yes. Diagnosed by the sputum examination? Yes. And what is the stain that we use here is Gomori-methramine stain, right? Gomori-methramine stain. And it causes disease only in immunocompromised host. That is also, what is that immunocompromised host? That is HIV. Okay, so that is the correct statement. So all of the following statements about Pneumocystis jirovecii are true except is usually associated with CMV infection. It's an incorrect statement, right? Last question. Drug of choice for Mycoplasma pneumonia is penicillin, tetracycline, cefuroxamine, and then erythromycin. It's a repeat question actually. It's erythromycin, okay? Right. The commonest sign of the aspiration pneumonitis is cyanosis, tachypnea, crepitations, rhonchi. So the commonest sign of aspiration pneumonia is increase in the respiratory rate, that is tachypnea. You may also have the crepitations. Basal crepitations can be there. But among all these, the most common will be tachypnea. There can be even rhonchi also. So these are some of the questions related to the topic of the pneumonia. Thank you very much.